it's actually never easy to get people together after a meal, especially such a delicious meal. So I first want to really thank Barry Siegel, his family, and the foundation, and everyone who worked so hard to make this foundation really be what it is. And what it is, maybe the people who've been touched by the support from the foundation know this more than we do. And I say this because even you know, when someone is hungry and then you are running around and you know where you are going to get food. So that's different from someone who is hungry and is biting his or her tongue. I don't know where I'm going to get the next meal. So I speak for myself and I speak for the community we serve. In my case, in Burundi, at Village Health Works, which is a story I'm going to tell you very briefly. And more people are here, my colleagues, Dr. Ziwen Haba, and Sarah Broom, who's the executive director, and others that we've been working together can tell you more about it. How we started the Village Health Works is very interesting. And I'm sure each one of you has a story. But I'm going to tell you my story. And you can tell your own stories and we'll listen. Well, there's a country called Burundi. And I remember a few years ago, I was traveling around. I think some of my friends and colleagues here have heard that story. So if you feel no, just forgive me. I was traveling, and then I came back from Rwanda, and then went to Burundi. It was before I was an American citizen, and I was traveling on a Burundian passport. And I arrived at home at JFK, and the immigration agent asked me, well, what is that? I had a Burundian passport, and a green card, of course. And I said, well, this is a passport from Burundi. And they looked at the passport and said, are you sure it's not Burma? Well, I said that it was Burundi when they left. And that got me, so it took me more time to get out of the airport than actually. But it's really a country that has a very, very tragic history. Same history as Rwanda, history of genocide and all that. But, so I went back home after several years, and I was visiting my parents. My mother was sick. And what I saw actually in hospital where she was a bunch of people who were incarcerated because they couldn't pay for medical bills. That was the only sin they had committed. And that was very devastating for me. So I came back home after helping my mother to get out using my student loans. I was in medical school. But that was a big challenge. I said, well, how many mothers and fathers, parents in this country who are actually as lucky as my own parents are to have a son who is going to medical school in the United States and can share with them student loans? I couldn't find anyone. So I went back to my village where I was born. Of course, a lot was going on. I was afraid. Some people were afraid of me. They couldn't understand that I was coming back from the United States in a place that was hell on earth. But there were people who have been dehumanized by misery. And when misery dehumanizes us, we become what we do that is not healthy to each other. And often we deal with consequences, not with the root causes of problems. So, revisiting that whole country and my village, remembering my childhood, looking at people who had spent 13 years on the run, chasing each other with machetes, knowing that there was nothing really that divided them. If you do not have clean water and you're on the same hill, you get the same problem. But so, how come that, there are, people in the same village are killing each other in the name of ethnicity? It's hard to understand. But if you sit down and then you look at the living conditions and then you understand that whenever something is affecting your well-being, you have no shelter. You cannot send your child to school. You are humiliated by misery. You cannot ask someone in my country, for example, what did you eat last night? Because you may be asking someone who has never had anything to eat. And then, if there's no food, that mother, for example, whose skills, whose life is to grow food, is a farmer but harvesting shade. Why? Because the land is not good enough to grow the right food, or you don't even know what you are growing. For example, where we are, most of the people grow cassava, and it's a pure poison. And yet, we have agronomists. Every school, university has all these people. Where are they? How come that we have some parts of the world that are lagging behind centuries? Where is development? Are we challenged, yes or no? So, this is why I love this time, because a time like this brings wonderful people together. And then we learn about our challenges, expected challenges from previous experiences, and unexpected challenges. How do we deal with that? Most of us here will go to places, we'll hear all these horrible stories going on all over the world, and then we will finish wonderful, get diploma, education, and all that, you name it, in this wonderful country. And then we go to places and we talk with a mindset, we are going to do this and that, and you have millions of people who are silenced by misery, but hardly anyone asks them a question, what do you need? Well, they are poor, but they are not stupid. And they are not poor because they are lazy, as they like to say. So, village health works. Went there. I was with this man here, Ziwe, who I like to tell this story, which usually devastates me, but he's used to that. We rented this vehicle and we're going to the hills, and he got hungry, and he started telling me that he was catching malaria. He had never been hungry. And he was saved by one of the people who were going to save. So that was interesting. Sorry, but I can't afford that. And we didn't have money, really. So we talked to community members. Well, you get sick, and when you are sick, you end up in the hospital if you are lucky, and if you do not have money, you are detained. There's no room for Hutus and Tutsis. Why can't, and then when they're in the same room, they are friends. Why can't you remain friends outside and work together and do something good? So this is what we did. And then we talked about, people talked about education, schools, they talked about health, they talked about a lot of problems. But our conclusion was that there is no way we can have schools when everyone is sick. Health, good health is a prerequisite. No one will be here if we were sick. So if we have access to care, we will get people who have expertise in education, for example. They will take the community that is healthy and be productive. This is our approach. It's a holistic approach. So we didn't have money, so what were we going to do? Well, we approached the community, there's no money, but you are going to participate. Not only they participate, but they also donated land. We chose a site, and we asked people, including my own parents, said, well, if this is for a clinic, we are ready to give it all to you, to build earthworks, and we are going to make bricks, we are going to dig stones. It was such a remarkable experience. And really, what does it say? It says a lot about listening to people. It says a lot about communications. When we help people, it's important to understand that they are also human beings, and receiving is good, but they also love to give. So participation is the key. If you are working wherever you are with people, with community members, make sure that get them involved. And that we would not be where we are today without the engagement of the community in Burundi. It has been really a model in the country. We are being asked to go to many different places, but we cannot do that because we want to achieve our mission in a way that we want to. And the community has been really changing a lot. Not only we are building medical facilities, but we are also building peace. We started seeing people who were former enemies coming together, making bricks together, and start talking to, why didn't we do this from the beginning? They know every single brick in every single building, where it came from, the layers, and they own it, they own everything. Now they are decision makers. We had a forum in December, and we decided that this forum was not going to take place in Boston, or in New York, or in Bujumbura, the capital of the country, but right there, so that people could speak for themselves. So they participate in decision making, and we work together that way. And I know that I don't have time left, that the government started saying, it's harassing me, but I'm kind of used to that. So, but I'm still around here. It's really important. It's important that you really, really reach out to people and sit down with them. It's not easy, but it's not as difficult as it is to be in this kind of situation. They will be your friends, they will support you, and you will support them, and you will feel like it's a true family, like the Single Family Foundation. So, keep up, do good, but don't forget the basic. Without the basic, you are not going anywhere. Get the community involved, get them on your side, they will be on your side, they will not betray you. Thank you very much.